and welcome to Episode 4 of Aligner Co's podcast. I'm your host Annie, and today I am joined by Dr Athar to answer some of your burning questions about clear aligners and all things dental. In your opinion, what is the best teeth straightening method?
Well, Annie, there is no one best way. It's all dependent on the type of the case. In some cases, you do need aligners, which works better than the braces. And in some cases, braces works better than aligners. So it's kind of a case by case thing. But most important thing about teeth straightening is the timing. So that when you should get the teeth straightening done, because if your teeth are not straight, you're going to get a lot of damage done. If you're already damaging your teeth, then you should definitely consider getting the teeth straightening. Discuss with your dentist and explore some other options, which is best for you.
What about cosmetic teeth straightening in particular?
So it's not a dental term, I would say, that cosmetic dental teeth straightening, but I hear this term a lot because on social media and on different when patients come to us for their visits, they are asking about that. And what I believe what they mean by cosmetic teeth straightening is that only you're focused on your front 6 teeth. Okay, so you're basically trying to align your teeth, and they may or may not improve the function of your bite. In general, as an orthodontist, we are supposed to look at the whole case, and we are supposed to fix the bite and make your bite more efficient and also aesthetically acceptable. But when someone says that I'm just trying to get cosmetic teeth straightening, I'm assuming that means just straightening the front 6 teeth, but keep one thing in mind: this may or may not improve your bite. So the function of your bite. So that's an important thing that I want everyone to understand, that if you're seeking any limited treatment, that is a limited treatment. So don't expect that everything will be fixed by that.
Okay, and then can you straighten your teeth and whiten them at the same time?
That's a good question. Yes. If you're doing braces, that's not an option. But with aligners, yes, that could be achieved. But again, I would very strongly recommend that you discuss this with your doctor, whether this is the best solution for you, because there are different aligner materials which may be friendly for those things, and some might not be. So I would suggest that discuss with your doctor, but short answer: with aligners, yes. With braces, no.
No, I can imagine you'd have some weird looking stains on your teeth if you did it with braces.
Yes, because what will happen is, if you will get that done, is because once your braces will be removed, you will have nice square shaped boxes on your teeth. So it would not look very nice. You will have straight teeth, but you would not have nice looking teeth. Also, if you have attachments while you're doing aligners, make sure that you discuss that with your doctors, because then the attachments can do the similar thing that braces would do with the whitening material.
Okay, so need to be careful with that. Okay.
Yep. Yes, my youngest patient on whom I have done aligner treatment is 8 years old. Okay. And my oldest patient on whom I've done aligner treatment is 87 years old.
Wow.
So that can be done. Main thing is, what are you trying to achieve from the aligner treatment? And what is the purpose of the treatment? What's the goal of the treatment? In 8 years old or a younger kid with mixed dentition, usually we do not do aligner treatment, just because mouth is changing so fast. You're losing teeth, new teeth are growing in, so aligners might stop fitting well. But if this is again a limited treatment, you're trying to get 1 or 2 teeth out of trauma, from traumatic bite, that's actually a very effective treatment. So again, depending on the goal of the treatment, we can do it on younger patients. Treatments can be done. Again, this should be answered. You should consult your doctor for that. That should they get it done or not. Most important thing is, there's no contraindication that you cannot use it on kids. But again, keeping the goals in mind is very important. And it's an interesting thing that I've learned recently. One of my patients, when we were doing those aligners on them, they still want to have something on them, so they get some stickers that they can stick on those aligners.
Oh, okay.
Have a
Yes.
Hello Kitty or something on that. That's interesting, but they still do some fashions with those. Yeah.
Yeah, very fashionable. That's interesting. Is it that some people report their teeth feel loose when they wear braces?
Okay, that's a good question, and that's a very common question that we hear in our office too. So whenever we are moving teeth, you have to understand we are kind of breaking the bone. Okay, I'm just at a microscopic level. Okay, and so the bone which is just around the roots of the teeth, we are kind of breaking that or causing micro fractures over there. Okay, and as a result of that, the tooth moves in that direction by applying the force. So the socket in which that root is widened, or it gets bigger, and within that socket the tooth can move around, so that's why I know I'm doing a little bit of a puppet show here, but this is how the tooth kind of moves a little bit and it feels loose. But if you, as soon as in a healthy individual, this should go away very fast. It can take up to 6 months or sometimes longer for it to feel perfectly normal. But in most of the patients, that's not the case. Within a couple of weeks or a month, you just feel like, okay, everything is back to
Okay.
normal. But if it takes even a little bit longer than that, there's no need to panic. Of course, I cannot stress more than this, that if you have any concerns, just stop the treatment and consult your doctor right away.
I could imagine that would feel a little bit worrying if you could feel your teeth shifting around in your mouth.
Yes, and I'll share this with you that when I started practicing orthodontics, the first time I saw that, even I got panicked. I'm like, "Ooh, what did I
Wow.
do wrong?" The
Yeah.
teeth, and they can feel, and you can see them moving a lot, but then it usually comes back very fast. The bone comes back fast, and it's stable right
And
away.
then what's the best way to remove clear aligners? Should we use our fingers? Should we use something else?
Okay. They do have some special tools for that can be used. But if you're comfortable removing with your fingers, that's fine. Of course, wash your hands before doing that. And for ladies who have those nails, I mean, they can break. So, it's be careful about that because sometimes these aligners can be very tightly fitted. And if you're putting force on it, nails can break. But the best way is to remove the aligners from the back teeth first.
Okay.
And so from one side, then from the other side in the back teeth, and then pull it out from the front.
Right.
The biggest mistake I see usually the patients make is they pull it out from one side and then they start pulling it out in one go, which causes a stress on the aligner, and then the aligners will start breaking.
Okay.
And they will crack from a certain point. If that's happening, it's almost certain that that's because you're not removing them properly. You
Okay.
don't have to bend a liner too much to remove it. It
Okay.
should come out. There will be some bending involved, but not too much. Otherwise it will fracture. So
Oh,
back teeth from the right and back teeth from the left, then pull from the front.
oh,
That's the way I usually tell my patients to remove it.
that's the best way to do it.
Yep.
Thanks for joining us on episode 4 of Aligner Co's podcast. Don't forget to follow our social channels online, linked in the description box below. See you next time.